Ever wondered what causes preeclampsia? We're diving into that very subject today. Preeclampsia, a pregnancy complication, is known for causing high blood pressure and indications of damage to another organ system, often the liver and kidneys. It's a condition that can be daunting, especially when its causes aren't quite clear. But fear not. By shedding light on the underlying causes, we can arm ourselves with knowledge. Understanding the causes of preeclampsia can help us prevent and manage this condition better. Let's unravel this mystery together. But what exactly is preeclampsia, you may wonder? Well, let's shed some light on this important topic. Preeclampsia is a condition that occurs exclusively in pregnancy, typically after the 20th week. It's known to affect around 5 to 8% of all pregnancies worldwide and is marked by high blood pressure and signs of damage to other organ systems, most often the liver and kidneys. Symptoms can range from mild to severe and may include sudden weight gain, swelling of hands and face, changes in vision, severe headaches, and difficulty breathing. However, some women with preeclampsia may not experience any symptoms at all, making regular prenatal checkups crucial. The potential complications of preeclampsia are serious. If left untreated, it can lead to eclampsia, which involves life-threatening seizures. It can also result in HELLP syndrome, a severe form of preeclampsia that damages the liver and blood cells. And let's not forget the risks it poses to the baby, including premature birth and low birth weight. It's important to remember that preeclampsia isn't a disease that can be caught or prevented by lifestyle changes. It's a complex disorder of pregnancy, intricately tied to how the placenta interacts with the mother's body. That's why monitoring blood pressure during pregnancy is so crucial. It's the most effective way to detect preeclampsia early and manage its impact. Now that we understand what preeclampsia is, let's delve into its causes. Preeclampsia has several causes, some of which are still not fully understood. Let's start with genetics. It's been observed that preeclampsia often runs in families, suggesting that there's a genetic component involved. If your mother or sister had preeclampsia, your risk of developing it is significantly higher. However, it's important to remember that while genetics can make you more susceptible, they don't guarantee that you'll develop the condition. Next, we have pre-existing medical conditions. Certain health issues can increase your likelihood of developing preeclampsia. For instance, if you have chronic hypertension, kidney disease, diabetes, or an autoimmune disorder like lupus, you're at a higher risk. Even conditions like obesity and a history of migraines have been linked to preeclampsia. It's crucial to manage these underlying conditions and to have regular checkups during pregnancy to monitor any potential complications. Now let's talk about lifestyle factors. Unhealthy habits such as smoking, drinking alcohol, and lack of physical activity can contribute to the development of preeclampsia. A diet high in processed foods and low in fruits, vegetables, and whole grains can also be a contributing factor. On the other hand, having a healthy lifestyle before and during pregnancy can help reduce your risk. Regular exercise can improve your overall health and help your body better cope with the changes of pregnancy. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains can also help keep your body in optimal condition. Lastly, age and pregnancy history can play a role. Women who are over the age of 40 or those having their first baby are at a higher risk. Similarly, if you've had preeclampsia in a previous pregnancy, your risk of developing it again is increased. While these factors can increase your risk, it's important to remember that preeclampsia can affect any pregnant woman. Regular prenatal care is the best way to catch and manage this condition early. These are just some of the causes of preeclampsia, but there's more. Continuing from where we left off, let's explore more causes of preeclampsia. The first cause we'll discuss in this segment is age. It's been observed that preeclampsia is more common in women who are under 20 years old or over 40. This could be due to the fact that the body's ability to adapt to pregnancy might not be as efficient at these ages. Next, we move on to obesity. This is a significant risk factor for many health conditions, and preeclampsia is no exception. Women with a high body mass index, or BMI, have a greater risk of developing preeclampsia. The reasons for this are not completely understood yet, but it's thought that obesity can cause inflammation and insulin resistance, both of which can contribute to high blood pressure and other issues during pregnancy. Now let's talk about multiple pregnancies. If you're expecting twins, triplets, or more, you have a higher chance of getting preeclampsia. This might be due to the fact that your body has to work harder to support more than one baby. The increased strain on your system could result in high blood pressure and other symptoms of preeclampsia. As you can see, preeclampsia is a complex condition with a variety of potential causes. However, it's important to remember that having one or more of these risk factors doesn't guarantee that you'll develop preeclampsia. It simply means that your risk is higher than average. There are many women who have these risk factors and never experience preeclampsia, and there are others who develop the condition without any known risk factors. Understanding these causes can be helpful, though. It allows you to be more aware of your own risk and take steps to manage it, such as maintaining a healthy weight and monitoring your blood pressure regularly. It's always a good idea to discuss your risk factors with your healthcare provider so you can make informed decisions about your pregnancy. Now that we've covered the main causes of preeclampsia, let's summarize. Preeclampsia is a serious condition, but understanding its causes can help us manage it better. As we've discussed, the exact causes of preeclampsia remain somewhat elusive, but we've come to understand that it's a complex interplay of various factors. These include a mother's immune response, her genes, and her overall health. Furthermore, certain conditions like diabetes, high blood pressure, and obesity can increase the risk of developing preeclampsia. But remember, having risk factors doesn't mean you'll definitely develop preeclampsia. Each pregnancy is unique, and even women who've had preeclampsia in one pregnancy might not have it in the next. That's why regular prenatal checkups are so crucial. They allow healthcare providers to monitor your health and the health of your baby closely. So, while preeclampsia can seem daunting, knowing its potential causes and maintaining regular health checks during pregnancy can go a long way in managing this condition. Remember, knowledge is power. Stay informed, stay healthy.